Okay, thank you. So welcome back. Our next session is session 2, Improving Innovation and Access Through Trade and Technologies for a Healthier World. This session will address how technology transfer, legal frameworks, and innovation ecosystems can expand access to health products and ensure equitable benefit sharing, especially in low and middle income countries. Please welcome our speakers, Dr. German Velacruz and Dr. Viviana Munoz from the South Center Geneva, Dr. Kaarlo Castren, Counsellor, Intellectual Property, Government, Procurement and Competition Division, World Trade Organization, Geneva, Dr. Yongyuth Mayalarp, President, Lifestyle Medicine and Wellbeing Association, Thailand, and Dr. Suwit Wibulpolprasert, Advisor to the National Commission on International Trade and Health Studies, Thailand. This session will be moderated by Dr. Manisha Shridhar, Regional Advisor from WHO Southeast Asia Regional Office, New Delhi. Please give a warm welcome.
Good morning, everyone. And it is my privilege to moderate this session. We have with us very eminent speakers, and I'm especially privileged that Dr. Suwit has agreed to join us and also speak on the session. So I understand that Dr. Yongyuth Mayalarp has to go, so I will request him then to take the floor first, contrary to what you have on your agendas. And then we will have Dr. German, I understand, perhaps cannot join, and we'll have Dr. Viviana Munoz, who will be joining us from Geneva. And we'll have Dr. Kaarlo Castren online as well, who will speak to us from the World Trade Organization. So, first of all, I think let's give ITH and Thailand a big hand for holding this conference every year without fail. I have been working in this area of trade and health for a very long time, along with this conference. And I really think that every year we select very important and topical areas. And this is the only conference anywhere in the world, in any organization, in any country, that is ever happening on these very difficult topics. And I think this is something that Thailand brings to the world, that we talk about them. And this helps us in many ways when we converge for our World Health Assembly resolutions, and these aspects are then brought up and discussed. It also helps us to think many of these things through before we approach on an international forum. So I think this is one of the most valuable contributions that we are making in this difficult space. In fact, after COVID-19, I didn't think that we ever needed to think that healthcare is important. I thought it was very obvious to everybody across the world that everything stops if health is not taken care of. But it appears that we go back and forth on this agenda, and we still have to have some of these discussions. And the session 2 is very well focused because we are looking at improving innovation and access through trade and technologies. And in the area of medical products, when we are working, very often we look at medical technologies. So we look at medicines, devices, drugs, and diagnostics. But if you look at innovation in healthcare, it's across the whole sectors, the service sector, even in simple things like disbursement. And one of the things that Chaim has built into this session is on AI. The way AI is actually changing the way we are approaching health systems across the world. It's a real, the pace of change has increased so much. And even in terms of drone technologies that are being practiced, they are new technologies, but how fast they will be taken up, we yet have to see. So on the one hand, we talk of innovation and technology, and then the pace of technology is also growing at a very, very fast rate. In this context, I must say that, on the fourth bullet, I was asked to talk about a little about the regional meeting which we had in Kerala. And while I have the floor, I just thought I'll take 2 minutes to explain a little bit. Post-COVID, we went back to the two major resolutions. One was an outcome of the COVID, which was on local production, which has also been spoken of in the previous session, and how we need to build local production so that we avoid some of the pitfalls that happened during COVID-19 on access to vaccines and other technologies. And this was a resolution which was passed in the WHA in 2021. And then in 2022, we had the Global Strategy and Plan of Action resolution, which was extended till 2030 in line with the Sustainable Development Goals. And the first meeting we had on seeing how to move these two resolutions forward was in 2023 in Thailand. And on the basis of that, it was decided, there were a number of recommendations, but one of the recommendations was that can we look at technology and how technology can be accessed better? And besides the TRIPS flexibilities that are there for accessing technologies, and of course, one of them has been greatly discussed on compulsory licensing. How can we use things like voluntary licensing and assignment and other ways to move forward? So post this in 2023, we had a meeting in Kerala in 2024, India, which looked at that. And let me tell you that Dr. Suwit spoke online in that conference, and it was very, he had few slides, but every slide told us something exactly what are the practical problems. And after that, the whole session started revolving on how best we could improve access in relation to the actual practical problems that we are facing. And I think he will bring some of them in our discussion today as well. But more importantly, as an outcome of that, it was desired that can we have a report on which looks at some of these technologies, which I have circulated to you. If you have the time, I have not yet taken out the main report from WHO CRO because I was waiting to circulate it in this conference. And if you have any suggestions, please tell us and I will improve that report and include that. Another point I do want to mention is that when we were looking at transfer of technologies across, we found that the National Institute of Health, the US framework for transfer and their format is what was being used with modifications across all the technology transfers that we were able to access. So since that was the base agreement, I have included 3 of them as the annexes. So you may like to look at it and if you have any comments, you're very welcome. So with this, I would like to close with what I wish to share. And it's a big opportunity for me to invite Dr. Yongyuth Mayalarp to take forward the session. He is going to talk on a very interesting area where he's going to look at lifestyle and medicine and how it can complement the health technologies for better health. So in effect, he's going to complete the whole picture and tell us what exactly we need to do. And we look forward to your presentation, Dr. Yongyuth. Over to you.
Thank you very much, Dr. Manisha. Very kind of you. My name is Yongyuth Mayalarp. Let me just show you the slide. And I'm from the Thai Lifestyle Medicine Wellbeing Association, abbreviated as TLWA. So you can look at us up on the website, tlwa.or.th. Basically, I would like to talk about what lifestyle medicine is and how it is related to today's event and tomorrow's event as well. Lifestyle medicine is been around for a long time, but basically we are suffering from these non-communicable diseases, which account for 7 in every 10 deaths worldwide, and these are caused by things that we can avoid. Basically, what we do wrong with our life. And what have we done wrong with our life? These are the unhealthy behavior that we indulge ourselves in, and it become habits. My job as a lifestyle medicine physician, as well as my colleagues, about 200 of us in Thailand, is to try to change the lifestyle, which is not easy. It involves a lot of engagement with the patients and also trust with the patient, and eventually manage to change their lifestyle sustainably. We may be able to find the inspiration for them to stop smoking, but you have to find a way to sustain that. They tend to be dragged back to their bad behavior by their friends. So we have to find a way to make them strong mentally. And that comes to the mindfulness. That is very important factor here. There are 6 aspects or pillars of lifestyle medicine. The first one is food, the whole food plant-based diet. Anything that you look around and you recognize as where it comes from, that means it's whole food. You look at a banana on the table and you can still recognize that as a banana, that's a whole food. But if you see that as an ice cream, that's a processed food. We don't recommend too much of the processed food, of course. And if we eat out the processed food, we enjoy it so much. We become fat, we got lots of bad things happen. This is a study involving taking 14 days of ultra-processed food and then switch over to the unprocessed food. And we found that you can eat unlimited amount of calories with the ultra-processed food. It's so delicious, but unprocessed food, not so delicious, but is very healthy. What can we do about that? Next thing is about the cessation of smoking and the avoidance of the nasty thing, risky thing, which include not only the cigarettes and the alcohol, but also the PM 2.5 and the microplastic in the environment. Stress management, emotional well-being. You need to balance the stress and the relaxation. And there are a number of tools. I mentioned one, which is the mindfulness, which is both religious and non-religious. And I think Buddhism is origin of many of the mindfulness practices that we're having nowadays, but you also have the non-religious aspect of that as well. Our association has MOU partnership with both the Buddhist side of the stress management organization and also with the Oxford Mindfulness Foundation, which is based their practice on non-religious approach. And we also have other things that help you with your stress management, like music therapy, art therapy, drama therapy, pet therapy, also museum therapy, and nowadays we have gallery therapy as well, and forest bathing. All these are the tools that we can use with lifestyle medicine. If we can have mindfulness, we can meditate for at least about 10 minutes a day. Your amygdala, which is part of your brain, this is to do with awareness of nasty things, work a little bit less, and you increase the function of your prefrontal cortex a lot more. So you're balancing about your mind, your worries, and you become more tuned to beautiful things, nice things, by simply meditating. Sedentary behavior is something that we've been working very hard on. How do we get people not just sitting around watching television or looking at their mobile phone doing nothing? As soon as you stand up, when you're sitting down, you're in the red zone. Your all-cause mortality is very high. But as soon as you stand up and starting to walk, then what happens? You go into the green zone. And the more you exercise, the better you are. There's no ceiling to the benefit that you can attain from your physical activities. We don't talk so much about physical exercise. We talk a lot more about physical activities because it's a bit of a hassle for people to think about having to change their clothes, their shoes and everything to go for the exercise. But if we can adapt ourselves to become more active in your life, that is a way around it. And you can just encourage people to cycle more, walk up the stairs more, and so on and so forth. Avoid the sedentary behavior. Sleep, another very important pillar of lifestyle medicine. We spend 1.5 1/3 of our time every day sleeping. Many people have misconception that you only need 4 hours sleep, and you feel yourself proud because you can do multitasking, but it's not enough. If you sleep only 4 hours a day, you're making a lot of errors in a very short time. If you don't sleep at all for 3 days, your errors that you can incur gain the maximum amount, 16 important errors that can happen a day. That within 3 days. But you sleep only 4 hours. You will take about 14 days to achieve the same level of error incurred. So it's very dangerous when you don't sleep enough, as well as when you sleep too much as well. Positive psychology and social connectedness. There's a study by Harvard University running for 75 years, looking at the graduates of the Harvard University in 1939 to 1941, and another 400 or so of the Americans living in the inner Boston with the lower socioeconomic status. And they found that the most important predictive factor for happiness and longevity is in fact social connectedness. So your friends are very important, particularly good friends, to make you live happy and long. Okay, these are challenges of lifestyle medicine. So lifestyle medicine doctor and their team work to change the lifestyle of the people. You need to have good assessment. You need to understand the context of the patients and the family, because all the members of the family play a very important role in the lifestyle of your patients. So you need to understand them and be able to assess and advise accordingly. This is a possible 7th pillar of lifestyle medicine, time in nature. If you spend time in nature, what will happen? This is a study in Japan, and they found that if you increase your time in forest, you will have better immunity. Your natural killer cell goes up. Why is that? Very interesting. You may think that it is all to do with mental health, relaxation and so on, but it may not be. Barefoot walking in the park, urban forest as well. CRP is the one that measures the amount of inflammation in your body. If you started up with high CRP and you go on walking barefoot in the urban forest, the CRP will go down significantly. Serotonin level, which is for happiness hormone, it goes up as well. That's interesting. And they found that there's something called phytoncides. It's a molecule emitted by the plants. When you go into the dense forest, we inhale the phytoncide, the molecule that emitted by the trees and so on and so forth. The tree use phytoncide to communicate to each other about impending danger from enemies around them, and also to fight off the fungus and so on and so forth. But people, when we go into the forest, we inhale the phytoncide and it enters our brain via the blood-brain barrier. And what happens is that your natural killer cell goes up, your immunity improved. So now the Japanese is now trying to extract these phytoncide molecules and try to see if you can get the same result if we are outside of the forest. Very interesting. Local green spaces and the blue spaces as well. The nearer you are to the green spaces, the trees, the forest and so on, and including your gardens, and the nearer you are to the blue zones, the lake, the beach and so on and so forth, your depression and anxiety goes down significantly. Every 360 meters you are away from these two zones, your depression and anxiety goes up by 5%. Another 360 meters further away than that, then the incident goes up another 5% of depression and anxiety. And if you have increase of your what you call NDVI, the normalization difference vegetation index, goes up by 0.1, then it linked to lower risk of depression. This is the NDVI. If you live in the area where it's intensely green, the NDVI of 0.72, you have very good health. You're in the dense forest. But if you live in the area where it's sort of brown like that, your depression and anxiety goes up. But if you increase that by 0.1, the incidence of your depression and anxiety goes down. So soon we'll have the recommendation to our patient to spend at least 120 minutes a week in nature, in your back garden even, that would be okay. and you find yourself feeling feeling well, feeling healthy. So that's something that may become prescription soon. Now, we have the digital era, we have the genomics, we have the epigenetics, we have the AI coming in. And if we can integrate all this information together, particularly the epigenetics, we can do something about that. Genetics, DNA, is something that we cannot change, but epigenetic is something that we can do something about. You can switch off some parts of your DNA and turn on the DNA part, the genes that can make you healthy. And if you can do that, we can do it with lifestyle medicine. AI can help us. AI can also inform us real time of what we are doing, and that will be very useful. But it's not replacing the doctors. The AI is actually enhancing what we are working on, particularly if we apply lifestyle medicine to change our behavior. So lifestyle serves as the on-off switches for the genes. Gut microbiome, very quickly, this is a new frontier in health. What if we can change the microbiome epigenetics? If we can change the microbiome in your guts before even your body starts to have change in our epigenetics, that means we actually catch right at the beginning of the diseases. Gut microbiome is very important. When you have a good balance between the good and bad microbes, you can avoid many of these diseases that you can see on the right-hand side, the depression, the heart disease, the diabetes, and so on and so forth, because 70% of the gut microbiome is involved with immunity. If you have bad microbiome becoming predominant, then you start having all these diseases that I mentioned. And we found that from the study in Thailand, the microbiome in Bangkok is different from the microbiome in our provinces, simply because we're eating less of the vegetables in Bangkok for some reason. And the young and elderly have different microbiome, and we can have the lifestyle recommendation accordingly. So lifestyle medicine can complement technology and innovation to improve our health. So that's basically my message for this morning. Thank you very much.
Thank you very much, Dr. Yongyuth. In effect, what he's telling us is if we do everything he says, we actually don't have to have any health problems. So the question of medical technologies and health technologies doesn't arise because we are already doing the right thing. And then, of course, the implication of AI. Thank you for this presentation. Since Chaim and Dr. Sampan asked us that we want to have at least one recommendation or an advisory, can you tell us in one sentence what you think should be the recommendation to move forward for this conference in relation to this complementarity? A research question or what you think we should do? And then we can probably move on.
I think the use of variables are very important to monitor ourselves, and it tells us real time what we need to do every day. It can give a very instantaneous feedback on the thing that we are doing wrong. If we can have very good variables that can tell us what we are doing wrong at this moment or what we are doing right, that will change everything.
Thank you. We'll move on to our next speaker, Dr. Viviana Munoz, Program Coordinator, IP. I hope we have her online. No, not yet. So let's go on to Kaarlo Castren. I hope he's online. Yeah, thank you. So he's our Counsellor, Intellectual Property, Government Procurement and Competition Division. And over to you, Kaarlo, for kindly making your initial remarks and presentations relating to the trade and technologies for a healthier world. Over.
Thank you. Thank you very much, Manisha, and thank you also for the overview of the outcome of the regional meeting now held last November in Kerala. I wish I could be with all of you in Bangkok. Now, sadly, I'm here in very dark Geneva. I'm not sure what that means from a lifestyle perspective. Probably not very good. But anyway, it's an honor to be invited to contribute to this very important and timely discussion. And I'd also like to acknowledge Ambassador Pitfield, who moderated the previous session, and whose expertise in IP and experience as a former chair of the TRIPS Council of the WTO bring real insight to our discussions today. I'd also like to mention and recognize my colleague from the WTO at the IP division, Roger Kampf, who I am sure that many of you know, and who I have worked closely with, including in preparing some remarks for today's event. Well, that said, maybe I'll say a few words about ongoing work at the WTO when it comes to trade and health. And recognizing that, like many of the challenges, Manisha, that you mentioned in the beginning relating to the pace of technological change, no doubt have a bearing on conversations going on here in Geneva. But there might be four main things that are worth mentioning regarding the type of work going on here in Geneva. Well, number one, WTO members have affirmed the importance of having a stable, predictable trading environment framed by WTO rules. On number two, there's also been the acknowledgement of the importance of the role that the multilateral trading system can bring to support diversified manufacturing capacities. And number three, the significance of transparency and resilient supply chains has also been recognized. And another thing that ministers have recognized is that strengthening productive scientific and technological capacity across the world can be instrumental for developing solutions to public health crises, including beyond COVID-19. Now, coming to the topic of this session, how to improve health innovation and access through trade and technologies, let me mention some ideas, and in doing so, I build on remarks made by Dr. Ngozi at the 11th high-level trilateral symposium that we hosted at the WTO in December last year, focusing on NCDs. The remarks that I make are naturally without prejudice to the positions of WTO members. Now, to start, first, and like this has been said and indeed recognized by members, as I just mentioned, there is the importance of having resilient supply chains and sustainable regional manufacturing, and that this can help avoid shortages in the future and help secure more equitable access to medicines. But it's not just about building supply chains and manufacturing capacity. I think what's important over the long term is that there is sustained and predictable demand. In other words, diversification of manufacturing capacities should go hand in hand with steps to ensure demand. Well, how to achieve this? That's one question that's been asked. And an answer that's been given is that pooled procurement can arguably help create reliable and predictable demand for production of medical products. Pooled procurement can also help achieve more than good value for money. Indeed, when linked to health and industrial policies, sound procurement practices may help foster technology transfer, build manufacturing capacities, and strengthen R&D. The division that I work for, that is the Intellectual Property, Government Procurement and Competition Division, organized a trilateral WHO WIPO WTO webinar on procurement practices last July. What speakers did at that event was to discuss the significant contribution of procurement to help achieve optimal outcomes for health. They also emphasized the importance of understanding the linkages between different disciplines and policy areas. I think that's one key thing to bear in mind, linkages between different policy areas and disciplines. A colleague from WIPO, for example, at that event, observed that public procurement can be a key driver of innovation in the healthcare area. He also noted that well-designed tenders can help reward R&D and improve access. There are also important linkages between pooled procurement and trade. As one of my colleagues noted at that event, trade agreements can help provide international suppliers with the market access needed to establish additional production and distribution facilities, while pooled procurement can help generate the level of demand necessary to keep such facilities operational. And that's one broad area that I wanted to mention, the role of procurement when one is thinking of how to address health issues. Second, it may also be important to consider things like transparency and coordination, and especially in relation to constructing new manufacturing capacities, especially at the regional level. For example, it might be good to know what is being done in different countries within a region, like Southeast Asia, to help ensure that new manufacturing capacities in that region complement each other to the extent possible. In a similar vein, it's arguably also important to map the supply chain issues that members in a particular region, again it could be Southeast Asia for example, are encountering. And that mapping is important to know what problems need to be addressed. Third, I think you can say that spreading innovative activities across countries might help make regional manufacturing more sustainable and could support the development of technologies better tailored to the needs of patients in a particular region. Moreover, collaborative approaches, including through licensing, can help diversify innovation and support access to medical products. I think that's an argument that also has been made. And then fourth, I think it also could be said that assessing how best to address public health objectives depends on each country's individual circumstances, including commitments under international agreements like the TRIPS agreement, bilateral commitments that countries have amongst themselves, commitments that countries have pursuant to RTAs. Other things that are relevant are things like existing manufacturing capacity, human and financial resources, and I mentioned already before, to have functioning supply chains. In conclusion, I think it can be said, and I think Manisha, like you were also emphasizing in the beginning, how innovation is key, and the IP system is indeed an enabler for innovation and access to new health technologies. Trade facilitating measures and streamlined regulatory procedures can also play a key role in this regard. Thank you. I think I'd stop there.
Thank you, Dr. Kaarlo. It was in a very interesting context. Especially, I like the way that you mentioned about procurement, because it looks both at the supply side and also the demand side. So you brought that out very closely and clearly. Because normally we look at procurement only at a demand side, and here you mentioned how it will promote good manufacturing capacity as well. And I thought that was a very important comment you have made, along with transparency and coordination and the importance of collaborative approaches. I think that is a very important point to keep in mind as we move forward. I will return to you for your final comments, for a research question and any other advice that you might like to give us to move forward. And taking this opportunity is, okay, Dr. Suwit, I have the privilege of requesting you for your remarks.
Thank you so much. After listening to Dr. Yongyuth, before I start my presentation, I would request all of us to close your eye and take deep breath for 3 times. Okay, are you ready? 1. 2. 3. Now you are ready to concentrate on my presentation, right? And apart from that, he also talked about physical activity. I request you to stand, and sit, and stand, and sit. Last one, stand and sit. Thank you. I'm going to move forward on the government procurement in a practical way. I have to do physical activity, right, rather than sit down. Bring the theory, the concept into real practice. What do we do in Thailand? We have our universal health coverage. Thailand is one of the not so many developing countries with universal health coverage. Thank you. 100% population coverage. The budget is very big. Total, 3 funds, total together, more than the 12 billion US dollar. But the biggest fund is about 8 billion US dollar. This is a big, big fund. Big purchasing power. And the government has the policy that what we call innovation list. If anything qualifies to be put on the innovation list, the government requests public procurement to procure at least 30%. What happened after several years? A research found that less than 1% were procured. So the board of the universal health coverage said that, no, we will not let that going on. For us, we will purchase 100%. But most of the products are purchased by the provider. So they start so-called central procurement, and they procure 100%. I don't go with this. Yeah. Government procurement over there. Government procurement over there, right? And we have the cooperation of 3 national agencies. Thai FDA at the top has to approve the product. These are medical products, standard, quality, efficacy. The NCITHS has to approve it on the innovation list. And NHS or National Health Security has to approve that this is part of the benefit package. And we are the one who going to pay to buy 100%. Okay? So there's an organization called TCL, Thailand Center of Excellence for Life Science. They provide funding support for the SME, for all these 3 to work together to achieve this. It's tough job, not easy. So these are the 8 products that we have already put onto the market with this system. 100% procurement. 8 products. From dental implant, dental root. Our universal health coverage cover dental root as well, but only for those who lost all their teeth and they cannot fix their plastic denture well. So we put 2 root on that. The price in Thailand, innovation product, is 3,000 baht. The lowest imported product was 700 plus, 7,000 plus. So we are much cheaper, right? When we roll out, we do it central procurement, and we distribute to dentists to use. Once we roll out this, the imported company reduced their price to 1,800 baht, 60% of our price, 4 times less than their original price. And they convinced the dentist that, hey, the dentist, don't accept those products, 3,000 baht. You go to tell them, give you 3,000 and you buy from us. What would happen? The 3,000 Thai product die. And soon 1,800 become 7,000 again. And if you want to buy 3,000, no more. Already die. See, that's how they kill us. Dumping, we call dumping. Okay? Colostomy bag. For those who have colon cancer and cut off their colon, and they have to, instead of defecate, normally the feces come out of the abdomen, and there's a bag. Imported product, 240 per bag. Our product came out, 150. So we purchased 100% there. Huge difficulties. First, the professionals, the nurse, the doctor, they are used to imported product. They work very closely with the company. The company invite them to dinner. The company invite them to travel abroad, enjoy themselves. And some other fringe benefit, I don't know. So they said, our product is not good. When you stick it, it drops. You stick it, it drops. They even take video clip to see clearly that our product is bad. It's not sticky. I was so surprised, how can this product pass through the approval of FDA and NCITHS to be on the innovation list? So I asked them, give me 4 bags. I put it here, on my own self. 4 bags, not just one. Upper, lower abdomen, right, left. And I put the toy clay of my grandson, like the feces, put in the bag. And I put the water, in case you have diarrhea, right? It may leak. And I steal some of the perfume from my wife to see whether it protects the smell or not. I stay with that for 12 days and night. Behave like a patient. No problem at all. This is what we are facing from health professional. And the embassy of that product called the director of the National Health Security Office who purchased this to her residence, have dinner and talk 3-4 times. Even invite him to the country. But he paid by himself. He asked me, I said, you go, learn, but paid by yourself. Now they reduced to 120 baht. 120 baht. Our price still 150. And they push every hospital to put pressure on us to give the hospital 150 baht. so that the hospital can buy that 120 by themselves instead of buying 240 earlier. So it's not easy, government procurement. You have to be very determined to do that. We have many things more. Even the drug, Acera pertussis vaccine. The latest one, the Inspecta chest X-ray, AI chest X-ray. We already fixed it in almost 200 hospitals now, paid by the Universal Health Coverage. Next year, it will become 800 hospitals. So these are the number of patients, the amount we have sold is still very low. It's not that high money, not that big money. It's about market price is about 700 million baht, which is maybe 25 million US dollar. It's still very small, but we aim high for the future. So this is a story of how to use government procurement for medical innovation and what kind of obstacle that you will face from the users, from the competitor. Previously, they control all the market. Now you want to kick them out, to replace with someone, they fight you to death, for sure. Some of our products even export, but still very, you see the fourth column, export market is still very low. Only the three-dimension 3D printing, titanium skull plate, very small, but it's moving. All this happened only 2-3 years. So we hope that by 10 years, it will fly. Thank you.
Thank you, Dr. Suwit. In fact, he's made a very important point in innovation because, one of the things we are still a little far behind from, say, the US FDA and others is the breakthrough innovation. The absolutely new medicine or new technologies that are coming up. But what Dr. Suwit has highlighted, that once that innovation is there, we are very smart at designing around and securing innovation for better access, because that is where we get better prices. And given the way that we innovate to make that happen, can bring access where that was not possible when there is a single supplier. So I just want to extend a bit on what Dr. Suwit has just said, because we in intellectual property we talk about patents, and patents is on new products, absolutely new products. But when you're looking at designing around the patent, and that is where more innovation results, and we can move forward in a very fast pace. And I also thank him for his comment on competition, because that is also linked to some of the previous discussions we had in the sessions on dumping and anti-dumping. So how does the whole area of competition work is very critical. And I think this is where the government's role becomes very important. So with these, do we have the third? Okay. So we will wait for if we get either German or Viviana on screen, but if not, I do think we have at least, Dr. Suwit, can we take 1 or 2 questions if the audience has any, and then go for the final recommendations? Thank you. So over to you, Dr. Suwit.
Any question? The National Health Security Office is very happy. First, because they save money. Look at the colostomy from 240 down to 150. They save money. Dental route from 7,000 to 3,000. They save money. And they are happy at that price. They don't want to save more and kill local innovation. But this is a big battle. And you need to summon partners all over the country. And you need to travel to boost up the morale, the commitment from health professionals. They are all heroes and heroines to help Thailand getting out of the middle income trap.
Does anybody in the audience have any question to any of the panelists here? I'm going to go back to you, Kaarlo. Can you hear us?
Yes, I can, Manisha. Hi.
Thanks. So over to you for your final round of any recommendations that you may have in terms of how you see the ITH conference going forward, and also if there are any other points that you may wish to add to what you have already made. Over to you.
Thank you, Manisha. I'll maybe say this. I think you already mentioned, summarized many of the things that I wanted to emphasize, and maybe if I may, I'd mention three. One is collaboration, and I think collaboration is key when it comes to strengthening health systems around the world. And I think this is true especially when it comes to collaboration among members, including at the regional level, and with respect to deployment of new health technologies. Voluntary collaboration between right holders and local manufacturers can also help facilitate technology transfer, and can help build manufacturing capacities, and ultimately it can help enhance access to pharmaceutical products. So that's one, it's collaboration among countries and collaboration as between right holders and local manufacturers. I think these are key things to consider. Another thing, like another area where I think collaboration is important is when it comes to international organizations such as the WTO supporting members in the work that members do. And an example of this is the way we collaborate and work together with the World Health Organization and WIPO on different events and different things and topical discussions of issues like, let's say, emerging technologies in the future, or before in the past, these different symposia that we've organized on different matters, one of which was NCITHS. And third, I'd say that in addition to bearing in mind the importance of working together, because one can't do things alone, it's important to remember that whenever one is addressing a problem, it may be important to keep in mind that having or applying a holistic, multidisciplinary approach can be key, especially when it comes to addressing complex things like achievement of public health objectives. And I think even more so in the sense that we're dealing with a time and age where new technologies, innovation is, as you said, Manisha, is occurring at a very fast rate. Thank you.
Thank you, Kaarlo. In fact, when you talked about new technologies, I was just reminded of the Food Regulators Conference, which was recently held last month in India. It was a global conference. And one of the issues which came up for discussion was new technologies to make sure that there is no protein deficiency. And the issue was that can we look at insects as a source of protein? And there was some people from Korea who were actually processing it and telling how a spoonful of their product can actually increase protein many folds. And there was a plea to look at this technology in the food space. So there is no dearth of innovation that is happening, but I think every government will have to take their own call. Because when they said that, I immediately thought that, there's a lot of strong vegetarianism, and if you tell somebody you have to take a powder of animal protein like that, it may not go well. But then for any athlete or bodybuilding, it could be useful. So there was a lot of discussion on that. Innovation and technologies are coming in many, many ways, and I think every government needs to take that forward.
No need for technology. In rural area, people take insect all the time. I worked 9 years in the rural district. In certain time of the year, insect come out. Very, very delicious. You just lit the fire, they come, and then you catch them, and then you fry them, put some fish sauce, or you grill them. So delicious. Believe me, we call them land shrimp. And it's sold in the market, in the fresh market, reasonable price.
Thank you, Dr. Suwit, and I understand that Viviana is now there with us. Viviana, over to you, and you have 7 minutes to make your presentation. I hope that's okay with you. Dr. Kaarlo, we are going to have Viviana speak to us in place of Dr. Sherman, who couldn't join. Over to you, Viviana.
Hello, and good afternoon to you all there. Good morning from Geneva. It's a pleasure to join you. I am here representing Germán Velázquez. As you know, he was unable to attend. He was very much looking forward to be there with you in person, but for health reasons, he's unable to do so, and he is under doctor's orders. He's also now taking care of himself, so I will be talking in his instead of him in this day. As you know, the South Center is an intergovernmental organization of developing countries, so we were very much involved in assisting our member states and discussing with others about the process of what we wanted to see coming out of the process of the pandemic agreement negotiations. And this 3-year process had a lot of expectations. And the expectations really, I think, were primarily focused on trying to ensure that we would have some legally binding commitments that would ensure that in the future a situation of what transpired during the COVID-19 pandemic, in particular on the aspects of getting access to not just the final products in terms of vaccines or diagnostics and treatments for COVID-19, but also access to the knowledge and to the technology necessary to allow all those different manufacturers, all those capable parties around the world to undertake quick research and development and to kickstart clinical trials much more speedily, noting that we were really in an emergency situation and we really needed to get the whole global system working in a different way than what we would have under normal market dynamics. So the expectations were framed, as you know, in the sense of equity and justice. And for developing countries, that was really critical to put that in a way that this would be binding commitments, and that's why there was such a push for an international legally binding instrument. We had many different collaborative initiatives, but these had been ad hoc. For example, what was organized by several institutions, with WHO taking a coordinating lead action, in particular for vaccine, global procurement and distribution for countries that decided to participate in that system under COVAX for vaccines, and others such as FIND for diagnostics, and many other agencies involved. So there was also this need to recognize that we had been acting in a very ad hoc manner during this crisis of COVID-19, and for the future, we needed to institutionalize some of those arrangements and ensure that we would be better prepared to establish them. And I think another very key area, and of course you've been already talking about this now, but in addition to ensuring that all countries can participate more fully in the research and development system, particular for emergency times, is to have adequate preparedness in between pandemics to ensure that we will be ready to be able to start to identify producers around the world who would be able to speed up production when we have a new pandemic, as well as general preparedness. So noting that as many previous pandemics had shown, the world is not prepared for such a situation. And so trying to ensure that we would have a new framework whereby we would set up the systems necessary and the investments necessary, especially to be better prepared at an earlier stage for a pandemic. And then also to ensure that there would be the financing available, particular surge financing, so additional financing that would be necessary to mobilize very quickly in the case when we do have a pandemic emergency, and that in particular to stop the rising spread, in particular in countries that are first hit, and many times that might be in countries that don't have the capacity to do that themselves. So surge financing being another. So as South Center, as I noted, we follow the negotiations closely and we followed their results. So we also have a view on what was the final outcome. So Herman has very kindly shared his slides. I think those have been shared with you. So I'm not sure if they are available, so I could highlight some of his points with the slides. Otherwise, I'd be happy to just run through them verbally. So if you could please let me know, should we have up the slides or should I just continue?
Yeah, I understand the slides are here. We will run through them. We just have about, say, 2 minutes.
2 minutes, exactly.
Yeah,
so I just wanted to note that you can look at Herman's slides to get a more detailed view of what was his, what he wanted to share with you on his views. Please, next. Next. So as I mentioned, the expectation was improving on equity and justice for future pandemics. And as South Center, we issued a statement and we focused on highlighting how important the outcome is in terms of it's only the second international legally binding instrument under WHO under Article 19. However, in our view, the agreement did not fulfill the expectations, in particular because most of the obligations that we wanted to see became voluntary, in the sense that you have wording that allows the parties, the countries, to simply, for example, it uses generally the wording of shall, which means that this is really more of an option. So that means that we are concerned that in future we might not see the concrete outcomes in the areas we wanted to see, as I have mentioned before. Please continue running through the slides. Thank you. Please, next. So one of the core areas that I did not mention, and I know from the program it will continue to be discussed, is the issue that the critical negotiation about ensuring that there would be some set-asides of production by the main manufacturers for treatments or vaccines or diagnostics. These set-asides that would be left for ensuring that where the needs are from a public risk assessment as well as for developing countries, this was left for negotiation subsequently under an annex of the pandemic agreement. And we are currently in those negotiations. And it's hard to tell whether they will be able to adopt this annex by the expected time of March next year so that it can be approved by the May World Health Assembly in 2026. So here, in that sense, the strategic error was we don't have any particular dedicated amount of medical countermeasures that would be set aside by manufacturers or any kind of production capacity that specifically will go to this aim as part of the pandemic agreement. There's Article 12 that establishes the elements of the pathogen access and benefit sharing system, which is PABS here. And then there's Article 13 that establishes that there will be a global supply and logistics network set up, but those elements are left with the conference of the parties to finalize. So that means that these are not yet embedded in the outcome of the pandemic agreement. Please continue with the slides. Next. So again, in that sense, what the PABs, which is in Article 12, will provide is quite minimal, in the sense that the only specific commitment that will be made by manufacturers is a 10% set aside of production that will be at affordable prices. So it's still up to negotiate what does affordable prices mean, and 10% donation to WHO. So what will happen with the remaining 80% is still based on what the global supply and logistics network might procure, or regional procurement, which it means that we still would be in the same uncertainty that we were during the COVID-19 pandemic. Next. Next, please. Just leave you with the highlights in terms of the main messages. Next, please. Next. So in conclusion, the pandemic agreement is an important new framework, but we now have to work towards building of what are some of the provisions that are there to strengthen them and to ensure that there is actual implementation of them in all across the areas of prevention, in the area specifically on facilitating technology transfer, on ensuring that public contracts with private manufacturers actually have access conditions. And this is one of the important areas, for example, in the Article 9 in the agreement, but that still will require ensuring that there is close implementation of and strengthening the provisions. And in that sense, you see the last message, the future depends on reopening negotiations for justice and solidarity to actually take place. So a lot still to be built. Thank you very much.
Thank you, Viviana, and lots of thanks for joining at last minute and for stepping in for German. I'm sure he's going to be very happy that it was you doing it for him. So thank you. And since we are short of time, you have made some very important comments on the general preparedness and improving that as in a systemic way. That was, I think, a very important point, and thanks for bringing out the details of the heart of the treaty still having to move forward. I think we'll have greater discussions on this in the next session. And also, you made a very important point on clinical trials and the fact that they should be speedily done. In fact, during the COVAX, if you remember, the FDA and others set up the roll-on review. And so before clinical trials 1 was over, we went for 2, and then clinical trials 2 was not over, and we were into 3. The idea was to bring forward the vaccine as fast as possible, given the emergency situation. And one of the things which we did discuss in WHO, but it doesn't seem to have a formal method, is can we improve some of the systems that we learned in the roll-on review to make it as part of the system of an FDA review? This is a discussion we also had in the CDSCO in India, whether some of those aspects could be adopted, and we are still far from getting any consensus on that, but you raised this very important point. I think given this, your suggestions, we will include that as summary of the suggestions that we have to give to Chaim and Dr. Sampan at the end of this session. Dr. Suwit, would you like to add anything before we close? Over to you.
Just one point. Don't just talk, take action. Talk the whole day and night, nothing happened. Take real action, realistically, not romanticize.
So with Dr. Suwit's word, it's my privilege to close this session. Thank you.
Thank you very much for the very insightful sessions. So now we will have a break for lunch, and will be at the Nourish room. And please return to our afternoon session at 1:30 p.m.